I don't think the government has any real role in the provision of healthcare. This should be an entirely private enterprise. And people say, oh no, it can't be private, it's too important. It's because it's so important that I think it has to be private and it has to be market driven.
Yeah.
The degree of complexity and scale in healthcare is just mind-blowing.
Yeah.
These are epically large, epically complicated industries. And I know that it seems like common sense. Well, because it's complicated, because it's huge, you need some bureaucrats to be in charge of it. No. It's when you have complexity and when you have scale that you need decentralization. You need a functioning price system to allocate resources.
You need the invisible hand.
You need the invisible hand to tell people where to invest. You've got particular demand for this kind of healthcare treatment. That's where more money needs to go. Now, the government will inevitably have a role in healthcare. There's bound to be some sort of regulatory quality assurance role.
Fair.
I would argue that the more competitive the market is, the less you need that, but people are going to want some kind of backstop. Understood. And people are also going to want to know that if they fall on hard times, they will be covered. So you don't want a situation where people are denied healthcare because they're too poor or because they lost their job or whatever it is. So you do have to have the government playing some role in saying, we will help you to participate in this important private market. So according to how limited your means are, we will provide a subsidy that guarantees you a minimum level of health coverage. But that basically is the extent of the state's role. And could you call that a national health service? It might be stretching it a little bit. You could certainly call it a national health guarantee.